Recurrent pregnancy loss can be a devastating experience. If you have gone through this, we are truly sorry for your loss. No matter how long it has been, you may still be grieving. This video focuses on the known causes of recurrent pregnancy loss, the tests we use to identify them, and the care options that are available. As you watch this video, please write down any questions you may have so you can share these with your healthcare provider. Across Canada, there is no single definition of recurrent pregnancy loss. When we talk about recurrent pregnancy loss in this video, we're referring to 2 or more losses before 20 weeks gestation. We acknowledge that this definition doesn't encompass all types of pregnancy loss that can occur. If you have experienced recurrent pregnancy loss, ask your provider for a referral to a gynecologist or a recurrent pregnancy loss program in your area. The causes of recurrent pregnancy loss are not always known. However, they usually fall into 3 main categories: genetic causes, medical conditions and diseases, and problems with the uterus and cervix. The most common cause of miscarriage is aneuploidy, a genetic imbalance in which the embryo has too many or too few chromosomes. Aneuploidy happens at the cell level before a pregnancy has even occurred. Human cells generally carry 46 chromosomes. If there is 1 chromosome too many or too few, the cell is aneuploid. An embryo with this type of genetic imbalance may survive long enough that you can see it on your first ultrasound, but often it will have stopped growing before this. Aneuploidy occurs randomly and cannot be prevented or treated. It is technically possible to test for aneuploidy at the time of miscarriage. However, since miscarriage often occurs without warning and most people miscarry outside of a hospital or clinic, testing for aneuploidy is rarely possible. There are also other, less common genetic variations that occur at the time of fertilization, in which only part of a chromosome is missing or duplicated. These variations in the structure of the chromosome occur randomly and are usually one-time events that are not preventable. However, in some cases, the variation may be inherited from one or both parents. Genetic testing may be used to find out if you or your partner have this type of genetic variation. If a genetic variation is found, you will be referred to a genetic counselor to discuss your results and how this may affect your future pregnancies. There are some causes of miscarriage which can be treated or managed. These treatable causes include medical conditions and physical problems with the uterus or cervix. If you have a medical condition such as high blood pressure, diabetes, a thyroid, or an autoimmune disease, it may be difficult for your pregnancy to develop fully. Although the reasons are not entirely clear, these conditions seem to interfere with the early development of blood vessels in the placenta, which are needed to supply blood to the growing pregnancy. Working with your healthcare provider to manage your condition is important, not only for your own health, but to reduce your risk of miscarriage and ensure a healthy start to any future pregnancies. Antiphospholipid syndrome is one example of an autoimmune disease that may affect pregnancy. It is a rare medical condition which may cause your immune system to produce antibodies that work against the new pregnancy. People with antiphospholipid syndrome are more likely to experience recurrent pregnancy loss, as well as complications in pregnancy such as preeclampsia, an underweight baby, or even stillbirth. Antiphospholipid syndrome can be identified through blood testing. If you have this condition, use of low-dose aspirin or other medications such as heparin can increase your chances of carrying a pregnancy to full term. In the weeks following fertilization, the blood vessels in the lining of the uterus undergo a number of changes to support a newly implanted embryo. Damage to the uterus caused by fibroids, scarring, or infection may impair this vital development. Variations in the shape of the uterus can also affect the development of the lining or impair implantation of the embryo. One kind of variation is called a uterine septum. Uterine septum is a condition you are born with. It occurs when an extra piece of tissue known as a septum hangs from the top of the uterus. It may be small, or it may be large enough to divide the uterus into two halves. A significant uterine septum can cause problems with blood circulation in the lining and may prevent the embryo from implanting or developing fully. Surgery can help to correct this. Underdevelopment of the lining of the uterus is another problem which may prevent the implantation or full development of the embryo. Accurate testing for this is not yet available. However, your provider may suggest supplementing with progesterone in the first trimester of pregnancy. Progesterone is a key hormone already produced by your body. Supplementing in the early stages of pregnancy may improve the development of the lining of the uterus. Supporting the entrance to the uterus is the cervix, a ring of muscle that plays a critical role in keeping the pregnancy in place. As pregnancy progresses into the second trimester, the expanding uterus places more and more pressure on the cervix. If the cervix is weakened, it may shorten and open too soon, leading to miscarriage or to the birth of a very premature baby. This condition, called cervical insufficiency, can only be diagnosed by monitoring the cervix during pregnancy. However, because it tends to happen more than once, your provider may be able to predict that you have a weakened cervix if you had similar problems with a previous pregnancy. If you have this condition, your provider may suggest starting progesterone in the second trimester to support the cervix. They may also recommend a treatment called cervical cerclage. Cervical cerclage involves sewing a stitch using surgical thread in and around your cervix to keep it closed longer. This procedure is done in the operating room. The most common tests used to identify variations in the shape of the uterus or the presence of a uterine septum are hysteroscopy and hysterosalpingogram, also called an HSG. A hysteroscopy involves filling your uterus with a saltwater solution using a small tube called a hysteroscope, which is inserted through your vagina into the uterus. The hysteroscope contains a camera, which allows your provider to look for any anatomical problems with the uterus. An HSG test is an X-ray of your uterus and fallopian tubes. During this test, a special fluid is placed in the uterus so that the walls of the uterus and fallopian tubes can be clearly seen on an X-ray. As the fluid moves, your provider looks for any blockages in the fallopian tubes or unusual divisions in the uterus. In addition to these tests, you may be asked to have an endometrial biopsy. A biopsy involves removing a small piece of tissue from the lining of your uterus and testing it to determine if there's an infection. If one is found, antibiotics may be used to treat the infection. These tests may be physically uncomfortable to undergo. They take time to arrange, and they cannot be done while you are pregnant, so it is important to work with a knowledgeable and supportive gynecologist to figure out which tests are right for you. After testing, you will review the results with your gynecologist and decide on the next steps together. It is important to acknowledge that testing may not provide you with all the answers. More and more studies are being done, but we still have much to learn about why recurrent pregnancy loss happens. Research has shown that between 50 and 75% of people will go on to have a successful pregnancy after multiple losses, even when no treatable cause can be found. Testing may help to rule out the most common contributors to recurrent pregnancy loss and allow you to work with a provider to create a personalized care plan. For more information about recurrent pregnancy loss and for a list of resources and support in British Columbia, please visit www.bcwomens.ca and search for recurrent pregnancy loss. Thank you to the many patients who shared their experience of recurrent pregnancy loss and provided critical feedback on this video.